This lesson is on literature review and synthesis by Dr. Sandra Spoelstra. At the end of this session, learners will be able to describe the process of literature review and synthesis and apply knowledge and skills learned in this lesson to conducting a literature review. Here's the background. Why are reviews important? It's to synthesize evidence to inform clinical practice. Clinical guideline development is predicated on the systematic review of evidence and recommendations for practice. So what is a review? It's an organized written summary of published evidence on a topic. It has clear objectives that are reproducible. It's a systematic search to collate all empirical evidence that fits pre-specified eligibility criteria to answer a specific clinical question. It uses explicit systematic methods to minimize bias, to provide valid and reliable findings from which conclusions can be drawn and decisions made. It's a systematic synthesis and presentation of characteristics and findings of included studies. So here's the problem. Healthcare is complex and needs highly trained clinicians to improve patient or system outcomes. Rigorous and robust synthesis of available evidence is needed. Implementation of evidence depends on literature review and synthesis. However, nationwide, faculty report a lack of knowledge and skills in literature review, particularly when advising students in acting projects. A recent survey found faculty were less confident in their knowledge and skills in literature review than recent DMP graduates. Therefore, there's a gap in faculty knowledge and skills in literature review, which may impact student learning. The solution is Prisma, the preferred reporting items for systematic review and meta-analysis method to conduct a review. It's a 4-phase diagram and 27-item checklist method to conduct a literature review and synthesis. There are 6 elements of Prisma. First is the title and abstract. Second is the introduction, which is a rationale and objectives. Third is the methods, which is an information source, search, inclusion criteria, data collection process, items measured, analysis plan, study selection, individual article reporting, synthesis reporting, and listing any bias. Fourth are the results. It's a summary of evidence or the limitation. And fifth and finally is the discussion, implications for practice, limitations, and conclusions. It's a process or procedure to improve patient or system outcomes. But please note there are 14 different ways to review the literature. However, Prisma is the gold standard. Here's what the 27-item Prisma checklist looks like. I provided an attachment for you to have this checklist, and it's also available online at this URL. So let's discuss the Prisma item 1 and 2, the title and the abstract. Item 1 is the title. It identifies the type of review and names the review using keywords and concepts, usually limited to 10 or 15 words. An example is nursing handover during patient care transitions, a literature review. Item 2 is the abstract. It's a structured summary, usually 100 to 250 words, which summarizes the key points from the review. It includes a background, problem and issue, aim and objectives, the methods, data source, study eligibility, criteria, participants, interventions, appraisal and synthesis, and the results of the review, the number of articles, type, and finding. And a discussion, limitations, conclusions, and implications of key findings. Here's a published abstract. Background. This article summarizes research and draws overall conclusions from the body of literature on fall prevention interventions to provide nurse administrators with a basis for developing evidence-based fall prevention programs in the hospital setting. Methods. Data were obtained from published studies. 13 articles were retrieved that focused on fall interventions in the hospital setting. An analysis was performed based on level of evidence using an integrative review process. Results. Multifactorial fall prevention intervention programs that included fall risk assessment, door-bed patient fall risk alerts, environmental and equipment modifications, staff and patient safety education, medication management targeted to specific types, and additional assistance with transfer and toileting demonstrated reduction in both falls and fall injuries in hospitalized patients. Discussion. Hospitals need to reduce falls by using multifactorial fall prevention programs using evidence-based interventions to reduce falls and fall injuries. That's a really good structured abstract. It was a little bit less than 200 words, and it touched on every element except the number of articles kept in the review. Next are items 3 and 4 in Prisma, the introduction. Item 3 is the rationale. It describes the rationale for the review in the context of what is already known, like the occurrence rate or impact of a problem, and it uses citations. Here's an example. The cost of a hospitalization increases by an average of $4,200 for a patient fall. Serious injury due to a fall may increase hospital length of stay of 6 to 12 days with an additional cost of over $13,000. This sets the backdrop for the review. Then, in item 4, the objectives. First, you state the overall aim of the review, usually in one sentence. Here's an example. The aim of this review is to report outcomes from the implementation of a standardized handover process utilized for patient transitions between inpatient units. And then following that, you provide explicit objectives about what is being addressed. There's usually 3 to 5 objectives. You can state them as statements or questions to be addressed. It's usually done in a PICO-type manner. Here's an example. This review aims to answer the following questions. Number 1, are there interventions to decrease falls in the acute care setting? And number 2, what interventions reduce falls in the acute care setting? Next are items 5 to 6, which are the Prisma methods. This is stating how you're going about conducting the review. This is a very important section. Item 5 is protocol and registration and is usually not applicable because it's only used when we're conducting a research study regarding evidence-based literature review, and it often has IRB oversight. Item 6 is important though. It's eligibility criteria. It specifies the inclusion, exclusion, eligibility criteria for the review. In other words, the characteristics of what you're keeping in your review. It's usually the years considered, language of the articles, the types of studies to be included, like a RCT, and the publication status. And usually you provide a rationale for the criteria. Here's one example from a D&P student paper. As you can see, this student segmented the inclusion-exclusion criteria into 6 different elements. First was article type. Included were meta-analysis, integrative reviews, systematic reviews, and RCTs. Cohort studies and no acute care setting were excluded. Language and geography. Only reviews in English were included, while all others were excluded. Countries with similar healthcare systems were included in the review. This included the US, Great Britain, Continental Europe, Ireland, Australia, and New Zealand. All other countries were excluded. Population. Falls in adults and over the age of 18, acute care hospitals and 24-hour supervised long-term care were included in the search. Populations under 18 or non-acute care were excluded. Intervention. Single and multifactorial interventions were included. Reviews that only reported the results without defining the interventions or procedures of the intervention were excluded. Comparison. Interventions compared to standard or usual care. Studies with independent elderly patients living in community dwelling or homes, outpatient departments, or emergency rooms were excluded. Outcome. Outcomes included were the number of falls, number of fallers, or rate of falls per 1,000 days. Studies that did not include at least one of these were excluded. As you can see, this example provides very explicit eligibility criteria. You know what to include in the review and what to exclude. Item 7, information source. Here, you describe the source of your information. You list the databases used in the search. Often it's CINAHL, which covers the nursing and allied health literature since 1982, or PubMed and Medline, which covers nursing biomed health journals published in over 70 countries. And you list the dates of the search. Here's a simple example. A comprehensive electronic search was conducted in CINAHL, PubMed, and Cochrane electronic databases conducted in 2020. And item 8 is the search. You describe your electronic search strategy. You include limits so it's reproducible, and it usually starts with a topic search by keywords. Here's the different types of searches you can do. You can do a subject search for topics or keywords in the database. You can also do a text word search for specific words and text fields, like in the abstract or title. It doesn't have to be the same as the subject headings in the database. Search programs have mapping capabilities, so quantitative studies keywords are usually the independent and dependent variables or the population, whereas qualitative study keywords are usually the central phenomena of interest in the population. You can also do an author search to search for a specific researcher who works a lot in a topic area. There's also an Ancestry and Descendancy approach. Ancestry is references of relevant articles read so that you can find other articles. Whereas Descendancy approach means that you're keeping pivotal studies, like a seminal study, which is the first study that prompted the initiation of research in the field, or a landmark study that marks an important turning point in the field. Here's an example. The flow of information through the identification, screening, eligibility, and inclusion phases of the review are shown. Keywords were accidental falls, hospital prevention, and intervention. Similar search terms were used, listed by using wildcard and Boolean operators and/or to broaden the search to include all relevant articles. Then, in item 9, you discuss the method you're using for your study selection. You state the process for selecting studies through screening and eligibility. Here's an example. The searches were limited to English language during the period of 2012 to 18 in the geographic areas of the US, Europe, Australia, and New Zealand, and being systematic reviews or meta-analysis. Item 10, you discuss your method for data collection. You're describing how you're extracting the data. In this example, it's Prisma. So your example of how you would write that up in your review is you would state the preferred reporting items for systematic review and meta-analysis Prisma guidelines served as the framework for this review. And then you cite it. And you should state that each article will be screened, retrieved, abstracted, and evaluated. Screened means you use the inclusion criteria. Retrieved means you read the article critically to comprehend the information. Abstracted means you make notes on key pieces of information in a table to organize data, evaluate the articles. And evaluated means the quality of evidence the study yielded led you to keep or not keep the study for the review. And just as a review, I wanted to go over the levels of evidence for data. As you're aware, Cochrane, meta-analysis and synthesis, integrative reviews, RCTs, and quasi-experimental studies are higher levels of evidence, whereas correlational, qualitative, and descriptive studies are lower levels of evidence, but they can be used in reviews if that's all that's available. I also want to point out that data that can be used in a review includes the gray literature, which are documents produced on all levels of government, academics, business, and industry in print and electronic formats that are protected by intellectual property rights, of sufficient quality to be collected and preserved by libraries and institutional repositories. So examples of this are conference abstracts, presentations, proceedings, trial data, government publications, reports, dissertations, patents, policies, or procedures. AHRQ has many documents that are considered gray literature, and many people have found this to be an excellent source to include in reviews. It just needs to be noted that it's gray literature and not a different type of study. Item 11 are the data items. This is where you list and define the variables from the data. An example of this is the N is the number of studies in the article and the number of participants in each study. Item 12 is the risk of bias. This is where you describe how you'll assess risk of bias of individual studies and discuss whether it's at the study or outcome level and how the information is to be used in your data synthesis. Item 13 is where you state the measures, and here's an example of how you would list your measures. Studies that measure a rate of falls as falls per 1,000 bed days will be included in the review. Item 14 is synthesis of the results. This is where you would describe your method of handling data, how you extract the items from articles, use a table, and then what you're going to be doing with the table. In a minute, we'll be discussing how we go about doing thematic analysis to examine and synthesize information. Since we're not doing a meta-analysis or discussing it today, you don't report on combining results. And item 15 is risk of bias across studies, which is the same as in individual studies. You assess it and then you report it. And item 16 is additional analysis, which in the most part we do not use. And then Prism items 17 to 23 are in regard to the results of the review. In item 17, we will be discussing how you go about selecting studies for your review. You have a process. You give the number of studies screened, assessed for eligibility, and included in the review, with reasons for exclusion at each stage. Here you use the Prisma flow diagram. Here's an example of how you would write this up in your review. The search yielded 643 articles. 15 articles were retrieved from CINAHL, 55 were from PubMed, and 573 articles were from ProQuest Medical. 6 articles were identified through review of references. 9 duplicates were found. Each review was screened using inclusion and exclusion criteria according to the Prisma criteria. Review of titles and abstracts resulted in removal of 618 articles that did not meet the inclusion criteria. In addition, 19 articles were excluded after in-depth examination of content because inclusion criteria were not met. The remaining 3 articles were included in this review. Here is what the Prisma study selection figure looks like. This needs to be used and included in your report of your review so that it's understood how you identified articles, how you screened, who was eligible or not, and what was included. Then in item 18, the results of the study characteristics are reported in each article, from each article in a table. The columns used are unique for each review as the topics change. But overall, the papers are listed by authors and year published, and then the focus of a study is reported. Sometimes the conceptual framework, theories, or models, and the study design, if it's a systematic review, RCT, controlled trial, or other. And the number of people or articles in the paper is listed, and their characteristics of the people or article. And we need great detail on the intervention. What does it include? What is the timing in relation to the event, the setting, the subjects? Is it tailored or standardized? In great detail. And then outcomes measured by name, definition, and if there were tools used. And the results. Did the intervention work by listing key statistics, p-values, or effect size? Please note we only use effective interventions to be included in a review because if it's ineffective, then it's not evidence and did not work. Item 19 is risk of bias, where you present data on any risk of bias. And here's an example. Studies that do not define a fall or measure rates of falls per 1,000 bed days will not be included. And then in item 20, you discuss the individual study results. For all outcomes considered, present for each study the summary of their data for the intervention, the effect estimates, and confidence intervals. Usually this is done in table format and also in text, and I show you an example in a second. Item 21 is synthesis of the results. In essence, you present the results across all studies by integrating and synthesizing the information across the articles using qualitative analysis. The focus is on identification of important themes. A variety of patterns can be pursued. Substantive themes are likely to be, what is the pattern of evidence? How much evidence is there? How consistent is the evidence? How persuasive is the evidence? And what are key gaps in the body of evidence? Oftentimes, these are the steps used to synthesize the results across multiple articles. First, what you do is you familiarize yourself by using a table to understand the individual articles selected to keep in the review. And then often what is done is a second table to collate interventions that reoccur with common meaning. An example of this table is shown on the right. And then often we generate themes by combining to create a single theme. As you can see, in bed safety, there are several interventions listed on the top in this table. Bed rails, alarms, lowering the bed location, and chair alarm are all listed under bed safety, which is becoming a theme. We then review the themes to make sure they're useful and accurate in representation of the interventions, and defining and naming the themes to make sure we understand the interventions. And then writing it up, which we'll show you in item 24. The second table helps you clearly think through what are the interventions found in the articles across one or multiple studies, and what do they mean for changing clinical practice. And then in item 22, again, we look at risk of bias across studies, specifying any assessment and reporting on it. Item 23 we don't usually use because it's additional analysis, but if it's used, it needs to be described. Next is the discussion section of Prisma, which includes items 24 to 26. In item 24, it's the summary of the evidence. In essence, you summarize the main findings by including the strength of evidence for main outcomes and consider the relevance to key groups. Here's an example of a well-written, integrated summary of evidence. Overview. 3 papers met inclusion criteria and were included in the review. An RCT, 2 quasi-experimental, a non-equivalent control group, and a pre-post test study were included. Characteristics. 2 of the studies were conducted in the US. 1 study was in Belgium. All studies were conducted within acute care hospitals. 1 addressed the nursing handover of any patient from an ED to an intensive care unit. 1 addressed the nursing handover of PEDS patients from surgery to inpatient, shift to shift, and from an ED to inpatient. 1 addressed the multidisciplinary handover of simulated pediatric patients transitioning from ED to PICU. Sample sizes ranged from 20 to 130 participants or addressed 7,864 handoffs in 23 hospitals. So after that section, you can see how many people were involved, how many hospital settings, what types of settings, and what location in the world where they occurred. And in addition to that, in the overview, we know the number of papers and what types of studies they were in each article. Next is the example of the intervention to summary. All 3 articles address the outcomes of a standardized handoff process. 1 provided a mandatory training session for nursing staff concerning a structured handover and procedure. Handover content was standardized and placed in an electronic aid. 1 included a control and experiment group. The experiment group was provided a 5-minute time for handover, feedback, and recasting of the same handoff after the initial handover was recorded and evaluated. The intervention group also received a cognitive aid to use during the second pediatric emergency simulation handover. The control group did not receive feedback, a time for practice, or a cognitive aid. 1 coordinated with 23 hospitals to evaluate the results of standardizing handovers. Each hospital in the study defined handover intent by developing a common understanding, defined a core supplementary aspect of handover content, created a standardized tool and format for the handover process, defined the time of responsibility transfer, and maximizing team effectiveness by establishing leadership and team building to develop a culture of safety. As you can see in the last sentence, that summarized and synthesized the evidence across all 3 articles. In the sentences prior to that in the intervention section, each of the 3 articles were discussed individually. This is a very well-defined exemplar of how to summarize evidence from a literature review. Then in item 25, you discuss the limitations at the study and outcome level and the risk of bias, and if you had any incomplete retrieval of identified research and why. Here's an example of how to write this up. Limitations of this review included the absence of randomized control trials related to PEDS or emergent patient handovers. The poor quality of research available also contributed to the low number of studies that could be included in this review. This also resulted in the expansion of inclusion criteria to include adult patients transitioning from the ED to ICU because no high-quality studies could be identified on this subject. An additional limitation of this review includes a lack of evidence regarding the sustainability of a standardized handoff process. These were all limitations in 1 review. And then item 26 is very important. It's the conclusions from the review. First, you provide a general interpretation of results in the context of other evidence, and you cite it. Here's an example. Patient handover communication is a safety concern according to JCHO, WHO, and IOM. This concern increases in high-risk areas and should therefore be a prioritized area for study and improvement. Implementing a standardized handoff process has the potential to not only improve staff satisfaction, but also patient safety. This review also demonstrates the benefits of utilizing a cognitive aid and standardized handover content to improve handover safety and standardization. And here's an example of how to write up implications from practice. Countless transitions occur for patients each day, and the potential for harm is introduced when the information is incomplete, inaccurate, misinterpreted, not relevant, or not timely. Implementing a standardized handover process in addition to a usable cognitive aid with a standardized handover content with training could reduce the incidence of these handover failures. This is especially vital for high-risk pediatric patients transitioning between high-risk areas. Addressing this issue not only improves staff satisfaction and increases patient safety, it is also in compliance with JCHO Provision of Care, Treatment, and Services Standard and the Performance Improvement Standard. So as you can see from this example, it's a statement of how the review conclusions are applied to the practice setting with what could be done differently. And then item 27 for Prisma is funding, and that's where you describe the source of funding for the review if there is one, and any other supports like provision or of data. And then we need to discuss how to actually conduct the review. You now understand the elements of Prisma, the 27-item checklist that needs to be completed systematically in an organized manner with a figure and table when conducting a review. But this is how to get started. There's an outline available to organize material logically for synthesis and to critically summarize the state of the science of existing evidence in a review. It includes the introductions, item 1 to 4 of Prisma, where you formulate an aim, objectives or questions for the review, and you write a title or abstract after the results and discussion are done. The methods, which are items 6 to 15 of Prisma, is where you actually are explaining how you're going about doing the review. You define the inclusion-exclusion criteria, information source, databases, and keywords. You quantify the search strategy and how you're going to synthesize information using Prisma, and you list items, measures, and bias. All of methods is talking about how you're going to go about doing it. Whereas results, which are items 17 to 22, is reporting on your findings of the review. Here, your search for evidence using the figure is elimination of articles is provided and explained. You use the inclusion criteria, starting with the title and abstract, screening for relevance and appropriateness. Then you read the full text and critique and evaluate each study and discard irrelevant, inappropriate studies. You list the characteristics in a table and identify any bias, and report individual study results, and analyze and synthesize the information, searching for themes or patterns across studies. You synthesize results of evidence. And then Prisma item 24 to 26 is the discussion, where you're having a report of the results of the review within other literature which is cited. Limitations are clearly stated and conclusions are drawn and what the implications are for practice. These are the simple steps of how to conduct a literature review. So in summary, a gap in knowledge and skills related to literature review and synthesis exists. There's a need to synthesize evidence to inform clinical practice, and use of Prisma allows organization of material logically to synthesize, then summarize the state of the science of existing evidence in the review, all to improve care or systems in healthcare. Thank you for listening to this lesson. There are several handouts for you to review in addition to this lesson. Thank you so much.